I gave you my heart.
Hi, I'm Dr. Hemalatha from Center for Sight KPJ. Okay, today I'm just going to talk about traumatic ocular injuries. Traumatic ocular injuries can be blunt or penetrating. Firstly, we need to assess the patient. And how do we assess the patient? History taking is very important. We need to ask them general questions like their age, occupation, their medical illnesses, and their previous eye problems. Specific questions that need to be asked is the time and the date of the injury. What are the specific eye symptoms they have, like blurring of vision, tearing, pain, swelling of the eyelids. Then we go to the vision taking. Visual acuity is very important. And then we do an eye examination from the front to the back of the eye. The fundus examination, which is the posterior segment of the eye, can be examined after dilatation. Systemic examination is also very important because most ocular injuries are associated with head injuries and fractures. Lid laceration. Lid laceration can either be due to sharp or a blunt trauma. Most lid laceration are associated with other ocular injuries, and you have to examine for deep and superficial foreign bodies. And also a skull x-ray might be required because there might be orbital wall fractures. What's the treatment for a lid laceration? We need to do a lid margin repair. So all lid lacerations have to be referred to the ophthalmologist for a lid margin repair. Periorbital hematoma. It's the swelling around the eyes associated with a bluish discoloration. In periorbital hematoma, it can be associated with other orbital fractures as well. What do we need to do for periorbital hematoma? You can do a cold compression and give analgesics, and most of the time periorbital hematoma will resolve within 6 weeks. Conjunctival hemorrhage can be due to many causes, but what we are focusing on is trauma. Most of the time, subconjunctival hemorrhage does not require any treatment. It usually resolves on its own within 4 to 6 weeks. This is when our crystalline lens becomes cloudy secondary to contusive eye trauma. It can happen immediately or over years. The treatment for this is to do a cataract surgery with a lens, intraocular lens implantation. Traumatic corneal abrasion can even happen secondary to a fingernail injury. Patient will usually complain of pain, redness, blurring of vision, and swelling of eyelids. The treatment is to patch the eye for 24 hours, but do not patch the eye if you have any suspicion of any infection. Patient will also require some antibiotic eye drops in this case. Usually, with the antibiotics, the corneal abrasion will heal quite quickly. This is a case when there is blood in the anterior chamber. Patient will usually complain of pain and blurring of vision. These patients most of the time require hospitalization. Bed rest is very important. Topical steroids will usually be administered. And also, patient has to elevate the head end of the bed so that the blood settles down. Patient has to be advised that rebleeding may occur. Ruptured globe can happen with a scleral or corneal laceration wound, or sometimes both corneal scleral laceration. Sometimes the intraocular contents may be out of the globe. In these cases, we usually fast the patient, give them systemic antibiotics, do an X-ray to rule out any intraocular foreign body, shield the eye, and we usually refer the patient to the ophthalmologist immediately for surgical repair. Chemical injury. It's important to know whether it's acid or alkali. This is because acid causes coagulation of proteins and limits the depth of penetration. In alkali, there's deeper penetration into the eye. Always remember that irrigation is the most important treatment. Irrigating the eye with either 1 to 2 liters of normal saline or until the pH gets stabilized is very important. How do we prevent ocular trauma? Patient education is very important. And in workplace, always wear a protective eyewear. And also during sports activities, it's usually important to wear a protective gear. For parents, they should be educated at home regarding the household items that can cause an eye injury. Those riding a two-wheeler always wear a helmet. And it's important to introduce norms of safe practice regarding eye injuries at workplace. Thank you.